Hey folks, Dr. Joe Esposito here. I am so happy you're with us today. Special segment today of the show. We're going to talk about liver problems. And a friend of mine has some liver issues going on. And so I've been giving a lot of advice on liver and getting really good results. And I thought, I shouldn't keep this a secret. I should share it with everybody else. Now, the liver is a huge organ. Skin is the biggest organ if you want to get technical, but the liver is like the biggest internal organ. And the good news about the liver is this. It's the fastest healing organ in the body. So if you're going to have problems with any organ, the liver would be the one I'd say, if you had to pick one, I would pick the liver. It's the fastest healing organ. I could have about 70% of my liver removed, and I can donate that to, let's say, Joe. If he needs a liver, I would donate it for Joe. 70% of my liver, Joe's my producer, by the way, if you don't know who that is, and my liver will grow back, and I'll still function fine. That's how amazing the liver is. But what we do to our liver every single day is horrible. Everything we eat, everything we drink, everything we breathe eventually filters through the liver because the liver is the big filter system. It breaks things down and processes it, detoxifies it, and unfortunately stores a lot of junk. And so we abuse our liver every single day. We do the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. We do this every single day. Keep dumping this junk into this filter, and then when the filter starts to get clogged up and malfunctions, we're shocked. How could I have liver problems? I've never had liver problems before. Has to start sometime. It's like a bridge collapsing. Well, a bridge never collapsed before. Yeah, I know. It wasn't this bad. And so car breakdown. Well, it never broke down before. It never got this bad. So you really want to take better care of your liver than you do. And we don't do that because we eat bad foods. We drink bad drinks or don't drink enough. The liver's a filter. You got to flush it out. And that's why drinking fluids, water, herbal teas is really important to do. So the liver gets abused all day, every day. How about chemicals? We did a show last week on Alzheimer's disease and acetate. Acetate is a chemical that can get into the brain and can form plaquing in the brain. And it was a really good show, by the way. If you missed it, it's on the website, drjoe.com. It's also on our podcast service, Dr. Joe for the Health of It. You can go to your podcast service and look it up there. I think it's been posted already. But I digress. So if you're putting bad foods in the body, it has to be filtered through the liver. Liver can send it up to different places in the body, and it can cause some real serious problems. So you want to keep that liver functioning the best you can. Now, there's over 100 different types of liver diseases, and there's a lot of different causes. Could be infection, too much alcohol, medication, legal and illegal, other toxins, obesity, cancer. All these things are putting stress on the liver. So even though there are different diseases and different causes, a lot of liver conditions damage the liver in similar ways. And because of this, they can look similar and have similar symptoms. And so sometimes with liver diseases, it's hard to differentially diagnose. Yeah, you got something wrong with the liver. It might be fatty liver. Okay, we do a biopsy or whatever. We do a test and we say, okay, you got fatty liver. Okay, well, what caused the fatty liver? Could be alcohol. When I went to school a couple hundred years ago, we learned that alcohol, if anybody had fatty liver, it was alcohol. That was it. Now, there's a new category called non-alcoholic fatty liver. Still fatty liver, but it happens to people who don't drink alcohol. So now we can't blame it on the alcohol. What else is it? And in many cases, spoiler alert, it's high fructose corn syrup. And I'll break that down for you in a little bit. But most of you are doing high fructose corn syrup. You might find it in soda. You might find it in your latte. You might find it in other places. Candies. High fructose corn syrup is everywhere. It's in cookies and cakes and donuts and pastas and tomato sauces. I mean, it's amazing where it is. And the reason we use it is this. It's cheaper than sugar and sweeter than sugar. So if I'm a manufacturer, that's when sodas switched from sugar to high fructose corn syrup, I can make a lot more profit if I'm using high fructose corn syrup than I can if I'm using sugar. So why wouldn't I use it? Well, it's way worse for you than sugar. But from a business standpoint, strictly economics, it's a great deal. It's cheap and it's sweeter. And in fact, even plain old white table sugar is 50% fructose, 50% glucose. The fructose has to be converted into glucose in order for your body to utilize it. That conversion occurs in your liver. We're talking about liver today. It occurs in your liver. If you do more than 20 grams of fructose a day, which is not a lot, it's probably a couple of pieces of fruit. And fruit's okay, by the way, but that's how much fructose is in there. You can eat fruit. I'm fine with that because there's other nutrients that kind of counteracts the fructose. But if you're doing basic American diet, you're eating way more than 20 grams of sugar a day, fructose a day. The fructose converts into glucose, and in the process, it releases something called uric acid. Now, uric acid gets in your joints, and it hurts. Now, as a chiropractor and a pain management specialist and a non-surgical orthopedist, we see pain patients literally all day, every day. So what we want to do is we want to not only give them what I feel some of the finest chiropractic care, therapy we can give them, but we also want to give them nutritional advice so that they can heal faster. And if they're sucking down high fructose corn syrup, uric acid is being formed as a byproduct or waste product. It gets in your joints and it hurts. You're not going to get the results that I want you to get. But that's not the worst part. Uric acid prevents the body from producing nitric oxide properly. Nitric oxide opens up your blood vessels, increases circulation to your brain, your sex organs, all your organs, helps the liver, flushes out the liver, the kidneys. So if you're not producing enough nitric oxide and you're getting old, nitric oxide levels drop as we get older. Now we have a big problem. So the number one supplements we have are Dr. Joe's Super Greens and Dr. Joe's Essential Source. Minimum supplements, everybody should be taking them every day. Prebiotics, probiotics, digestive enzymes, complete multivitamin, dried fruits and vegetables with phytonutrients. I mean, it's just amazing. The third most popular supplement is nitric oxide. Opens up your blood vessels, increases circulation for many purposes. So it's helpful to make sure your nitric oxide levels stay high. And you can do that by eating a good diet, and then you can supplement as you get older with some nitric oxide. And I say anybody over 30 should probably be taking some nitric oxide. So we want to keep that liver as clean as we possibly can. Now, there's two types of liver problems, acute and chronic. Acute, sudden onset. Chronic is what most people have, long-term onset. And this can happen even if you take things like acetaminophen. Over the counter, totally harmless, acetaminophen, no big deal. It can lead to chronic liver damage. So I take a supplement called glutathione. Glutathione became popular because there was a certain viral infection that got a lot of attention, and people were taking something called N-acetylcysteine, NAC. N-acetylcysteine is the precursor to glutathione. So there was a big controversy. You couldn't even get N-acetylcysteine. It was being pulled off the shelves. Glutathione is what N-acetylcysteine becomes. I take it every day to help my liver, but also helps my immune system. It's the master antioxidant in the body. So I take that every day. If you are taking medications, I would probably suggest you consider supplementation for the liver. If you're not taking medication, I would probably suggest take supplementation for the liver. So the liver is really important. You want to keep it healthy. Autoimmune diseases, viruses, these can all damage the liver. And again, it happens slowly. So glutathione, I love it. I take it every day. I think you should probably make it part of your protocol as well, especially for the immune system. It's when people ask me, what's my immune protocol? Super Greens and Essential Source, vitamin D3 with K2, acetaminophen, glutathione, and then probiotics. Now, we have a probiotic on the website, drjoe.com, called Immunobiotic. And there's 2 strains of good bacteria in that immunobiotic that has been shown to help, in some studies, not guaranteeing it's going to cure anything, with viruses, colds, and flu, and viruses. So that's something that's very popular with us as well, the immunobiotic, because it's not just for your digestion, specifically to help the immune system. So another thing I take every day. All right, so how do you know you have a liver issue? Well, many times you don't. You're glad to know that there are certain signs, well, not glad, but there are certain signs and symptoms you might want to take note of. Belly pain, constant pain, especially on the right side, not feeling hungry, loss of appetite, tiredness and lack of energy, diarrhea. You might gradually feel sick, and you may not know why. I just don't feel like I used to. Gosh, doc, I used to run around. I had 2 jobs, and I was out partying and I was out to clubs, and I just don't have the energy that I used to. Well, that could be a lot of different things, but many times this is insidious. It's a slow process that happens. One of the flagship symptoms is yellow eyes or yellow skin. As the liver gets damaged, you notice the problems become more clear. It's more obvious. Your skin may start to turn yellow. The whites of your eyes start to turn yellow. Doctors, we call that jaundice. There's a big fancy word for it. It happens when too much of a yellow substance from your red blood cells called bilirubin builds up in your blood. The liver isn't processing it out. Normally, your liver would clear out the bilirubin. It's not doing that. A damaged liver can't keep up. Bilirubin rises. You get the yellowing, the jaundice. So that's telling you again, time to take care of my liver. Most skin conditions, itchy skin, rashes. Many times doctors will say, well, we don't know what it is. Maybe it was contact dermatitis. Good general term, meaning I touched something and it made my skin itch. Now, it could be dryer sheets. I used to have a roommate named Kay many, many, many years ago, and she was wonderful. And we lived in separate parts of the houses, but periodically, she would take my laundry out of the washing machine, throw it in a dryer, and then fold it for me. Wonderful. Great roommate. Well, I started noticing I started itching a lot. I didn't correlate it until it took me a second. Well, one day I went down to get the clothes out of the dryer, and she had put in dryer sheets. It was my clothes. The dryer sheets were giving me a contact dermatitis, contact meaning touching my skin, dermatitis, inflammation of the skin, and I was itchy. I asked her not to do it anymore. Itching went away. But in that case, it was superficial. Many times when I see skin conditions, it's related to the liver. So whenever I see skin conditions, I always think, let's look at the liver first. May make you hard to sleep because you're itching all the time. There are medications you can take. However, we're trying to get you away from medications if we can. Sometimes we can't. Sometimes we have to take medication. I'm trying to get you away from it if we can. So just consider that. Swollen belly. This is a biggie. It's called ascites. If your liver is scarred, it can block flow of blood into your liver and raise the pressure around the vessels around the liver. That makes fluid seep out of the blood vessels and collect in your abdomen. Maybe a little fluid, or it could be a lot. Had a case the other day came in, and it was so swollen, and they said, Dr. Joe, you're my doctor. You're going to be able to fix this. I said, no, you need to go get a medical evaluation. And so I sent them out to a gastroenterologist that we work with. And the bile duct was clogged. The little tube that allows bile to release from the gallbladder into the colon was blocked. So they went and they put a stent in. It didn't work. Next week later, they put another stent in. And the ascites, the fluid buildup was so much, it was 5 liters. Imagine, 2-liter bottles of soda, 2.5 of those. So they drained it. It worked a little bit. It's had a little bit more. They had to do it again. And so now we're running more tests. But the ascites was a sign that there was something wrong, and we got to worry about that. So foods, we talked about high fructose corn syrup, non-alcoholic fatty liver. Of course, alcohol can lead to fatty liver. That was the hallmark symptom, so hallmark condition that we always look for. Pesticides can lead to fatty liver. That's why I try to eat as much organic food as possible. If you're going to eat animal products, meat, butter, cheese, yogurt, eggs, ice cream, I'm going to strongly advise organic only or don't eat it. Because we spray pesticides on a lot of commercial foods, and that can become an issue. But when the animals eat the corn and the soy that have been highly sprayed, those pesticides build up in the animal fat. So where do we see animal fat? Butter, eggs, meat. That's the thing that gives it the flavor, that fatty feeling. So it concentrates the toxins in the fats. So that's why if you're going to eat animal products, I recommend organic only because they're not being fed anything that has pesticides in it. Bad digestion. If you have heartburn, acid reflux, burping, gas, bloating, the food is trying to be broken down in the digestive system, and it's not efficiently. So then we did a show 2 weeks ago on leaky gut where the lining of the colon, the cells can open up and allow undigested particles of food to pass into the blood system. So these bacteria, fecal matter, undigested food gets into the blood system. The blood system has to be filtered out. Where does it get filtered out? In the liver. And so if you have digestive issues, you're putting a huge strain on your liver. So that's why you might want to come see us so we can try to get to the cause of your digestive problems, not just treat the symptoms. Maybe you need digestive enzymes. Maybe you need probiotics. Maybe the stomach needs to be adjusted, pulled down away from the diaphragm, the ileocecal valve, the valve between the small and large intestine. We can physically adjust these things. Chiropractically open up the nerve supply from the spine that controls the digestive system. Get you on foods that are easier to digest. Fruits, vegetables, nuts, and seeds. And then we take the stress off the liver indirectly. So that's why it's so important to take care of your body. Glutathione, we talked about that. I take it all the time. Nitric oxide, open up the blood vessels. I take it all the time. But if you're beating the heck out of your liver, eventually it's going to come back and bite you. It has to. Your liver heals, like we said at the top of the show, fastest healing organ in the body, but eventually it's going to give up. It can only fight the battle for so long. I had a friend of mine who drank a lot every night. I'm fine. I can function. I never missed a day of work. It's no big deal. It's going to come get you. And alcohol not only affects the liver, alcohol lowers your testosterone levels. And we need testosterone not just for sex, for men and women, but to build muscle. Your liver, your heart, your lungs, your biceps, your triceps, your colon, these are all muscles. And we got to make sure we have enough testosterone to keep them working. Alcohol not only affects the liver, lowers your testosterone. You can take exogenous, outside testosterone, but the more you take, the more your body says, oh, I have plenty of testosterone. I don't have to produce my own. So the weak organs become weaker, the testicles and the adrenal glands. So they make testosterone. So they're getting weaker and weaker. Why would you do that to yourself? Really, when you sit back and look at what you're doing to yourself, you think, why am I doing that? It doesn't make a whole lot of sense, especially since there's an option. It's like with drugs. When drugs are on the market, they have to go through this whole big FDA approval process unless there's no other option. Well, you're keeping this drug from this person and they need it to keep themselves alive. So the FDA has a guideline that says, okay, unless there's no other option, then you can use this drug for this purpose. But I want to give you other options. I'm not saying don't take drugs. If you need them, take them. Legal, of course. But what other options are there? And that's what this whole show is about. So if you like what you're hearing, if you go to our website, drjoe.com, we have about 2,000 hours of podcasts just like this, video and audio. 63% of people are visual learners, 65% are visual learners. So we have the videos for you. Then we have the audio. And if you have a podcast service, go to Dr. Joe for the health of it on your podcast, Dr. Joe for the health of it, and you can listen to our podcast there. YouTube. We have hundreds and hundreds of hours of videos. Dr. Joe. My handle, by the way. Oh, you need to follow us on social media at Dr. Joe Esposito. That would be YouTube, Facebook, Instagram, and Twitter. We post almost every day. Sometimes it's fun stuff. I went to a great concert the other day. I posted a picture. Sometimes it's recipes. Sometimes it's health tips. Sometimes we have giveaways. We've given away concert tickets to our people that follow us. We've given away chiropractic care. We've given away supplements. So at Dr. Joe Esposito, you need to do that right now. Facebook, Instagram, YouTube, and Twitter. YouTube, again, so many videos. I don't know. I'm the only person I think that's seen them all because I've been in every one of them. There's so many hundreds and hundreds of hours of videos that we have there. And by the way, the cost for all that is no charge at this point. So you might as well enjoy it. And if you want to make an appointment to come see us in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. Go to drjoe.com, drjoe.com. You can book right online. Call us. The phone number's everywhere. We accept almost every insurance out there. The only ones we don't accept are the ones that don't pay us enough to make it that we lose money if we take it. But we have cash plans available that are so ridiculously affordable. I promise you, you can afford them. So if you want to become a patient, drjoe.com. We'd love to see you. Car accidents, folks, please. If you're ever in an accident, please come see us as quickly as possible. Because the insurance companies play games with you. Oh, you weren't hurt. You didn't go to the doctor. I couldn't go to the doctor. I'd have a car. Okay, come see us. We have transportation available, and some of our offices have that available too. We want to be your doctor, drjoe.com. First visit is $299. It used to be, usually it's $720. We've reduced it to $299. Amazing. Exam, x-rays, consultation, first adjustment, next visit going over your x-rays, and a complete nutrition evaluation. I don't know how to make it easier for you, folks. drjoe.com. And if you're under care in the VA, if you ask them to send you to us, we accept VA patients. We're one of the clinics that works with the VA. They will send you here, hopefully, and pay for your treatment. So why wouldn't you do that? drjoe.com. Make an appointment right now. Bring your kids too, by the way. I want to get the kids healthy. Other signs of liver issues. Swollen legs or ankles. Like I said, we talked about ascites building up in the abdomen. The liver is a filter. And if the liver is clogged up, you can get back pressure. Many times varicose veins. There's back pressure, and that can cause problems. So these are signs that the liver needs to be flushed out. And we just gently clean it out. There's ways to do that. When you go to the bathroom, your pee is very dark. that can be a problem. If your poop looks pale, that can be a problem. These are all signs that the liver might be an issue. If you're tired all the time, if you're confused, this can be lingering side effects of the liver. It might happen because toxins build up in your liver aren't being cleaned out properly. Toxins build up in your bloodstream, that affects your brain function. You might find it confused, hard to concentrate. All of these could be liver issues. Not always, but could be. Nausea and vomiting. That's always a sign. If you have chronic nausea and vomiting, that could be an issue. Now, I've had a lot of patients over the years come in with some of these symptoms, have their gallbladder removed, and the symptoms don't go away. I see this all the time. Now, I am not a surgeon. I can't tell you to have your gallbladder removed or not, but this is my opinion. If the gallbladder is diseased and starting to rot, you probably need to have it removed. If it's not, I would say let's do everything we can to clean out the liver and the gallbladder. And in many cases, those digestive problems are not coming from the liver, they're coming from the stomach. And we're able to pull the stomach down away from the diaphragm, and suddenly the digestive system starts working again. I had a young girl the other day, and she was probably 20 years old, had her gallbladder removed. She was in the prime of her life. She was in great shape. She was pretty. She was smart. She was funny. And she was just terrible with her digestive system. She couldn't even socialize because she had gas and diarrhea, and it was just terrible. And she had her gallbladder removed, didn't do a darn thing. We adjusted her stomach within about 3 or 4 visits. She came in all smiling, and her mother said she went out on a date. It was so cool. I was so happy because she was able to not have to worry about, having digestive issues on her date. So many times it's not the gallbladder, it's the stomach. Sometimes it is. I'm not a surgeon, but I always say let's try the most conservative approach first, and then we can escalate the care from there. And that's why if you want to make an appointment to come see us, that's how we treat our patients. Most conservative first, escalate the care, chiropractic, supplements, injections, pain medications, pain management if we have to send you out for more pain management, spinal injections, surgery. But we want to get to the cause of your problem, not just treat the symptoms. So you want to get the liver conditions as quickly as possible. Lots of people with liver problems don't seem sick. So as damage to the liver gets worse, the symptoms then start. And if the damage is gone too far, it might be too far gone to even fix. And I hate when patients like that come in our offices. But knowing what you're looking for can help you catch these liver problems early. And the way you'll have a chance to stop the damage and it'll heal before it's too late. So if you have a bad diet, consider that the liver may not be working properly. If you have the symptoms we just talked about, could be a liver issue. If you drink alcohol, always a liver issue. The liver can only process so much before it can't process anymore. One of my teachers used to say, it's never a problem till it's a problem, and then it's a problem. And that's true. So always act proactively when it comes to healthcare. It's a lot better than reactively. So if you do want to come see us, my doctors would love to see you. We have offices in Marietta, Duluth, Stockbridge, and West Cobham, Atlanta area. drjoe.com, book an appointment right online. We accept almost all insurances, car accidents, sports injuries, workers' comp, VA cases. We see a lot of veterans. The VA sends us a lot of cases, and they even pay for your treatment. So you can book an appointment. You can call us, do it right online. We're more than happy to see you. Please follow us on social media. This is your cover charge. I give you all this information. I give you all the podcasts. Dr. Joe for the health of it on a podcast service. drjoe.com. We have videos, audios, YouTube at Dr. Joe Esposito. All that is no charge to you. The only thing I ask is that you follow us on social media at Dr. Joe Esposito. Supplements all on the website too. We'll ship them to you or come by the offices. Save us some shipping costs. Save you some shipping costs. But come see us. Any questions, send them to me through the website, drjoe.com.